Hi everyone, we're Group Influx. I'm Candice Cooper.
And I'm Kristen Formosa.
And our topic for our policy paper is mental health in children and adolescents. So basically what we found is that this field is very neglected when it's compared to adult mental health. But luckily there's been a recent interest in early intervention in youth, which means that the mental disorder will be targeted at a younger age, and this will lessen the problems for the children into adulthood. We found that 20% of children and adolescents have a diagnosable mental illness, but the reality is that only 1 in 5 actually get treatment. So overall, there's a lack of research, a lack of funding, and a lack of policy for children's mental health. We found that overall, the field has progressed a lot since the colonial era. Children went from being institutionalized and criminalized, but now mentally ill children are trying to be rehabilitated. The problem is that the treatment options for kids are often a lot more limited than they are for adults. So this leads to less research, less evidence-based practice, and also the use of antipsychotic medication is highly controversial in children and adolescents. So when kids aren't treated, this leads to a variety of different problems, such as incarceration, low academic achievement, substance abuse, and many more issues. So like I mentioned earlier, recently there's been an interest in early intervention because if the disorder is targeted at an earlier age, then there's less of a chance that more severe symptoms will happen in adulthood. So one of the major topics that we came across in our research was the use of antidepressant medication. We found that major depressive disorder affects about 5% of adolescents, but the knowledge of this treatment is very limited, but the use of SSRI medications, which are antipsychotics, in ages 10 through 19 has drastically risen in the past decade. Some research suggests that the medication causes suicidal thoughts and behavior, but then other research contradicts this, so this makes the topic very controversial. So in response to some of the research, in 2004, the FDA issued a black box label warning, which is the most serious type of drug labeling warning, and it said that antidepressants may increase the risk of suicidal thoughts or behavior in some children and adolescents. So currently, the only antidepressant medication that's approved by the FDA for children ages 8 and over is Prozac. But even with this approval, it's not uncommon for doctors to prescribe other SSRIs to children and adolescents. So as of right now, this FDA approval and the black box warning is the closest thing we have to a policy regarding the use of antidepressants in children and adolescents. So this just further demonstrates that this field is neglected and there's a need for more research. So another major issue that we came across in policy was insurance. So one of the reasons why it's hard for children's mental health issues to be addressed is because insurance doesn't cover the treatment. But we are slowly making progress in this area as well. In 1996, the National Mental Health Parity Act passed, and this required that insurance plans that offered a mental health benefit apply equal limits to both mental and physical illnesses. It did not require that plans cover mental illness, but then in 2008, the Mental Health Parity and Addiction Equity Act expanded these requirements to include treatment limitations, co-payments, and other financial requirements. So most recently, the 2010 healthcare reform made mental health coverage an essential health benefit. So by 2014, insurance companies will be required to provide coverage. And another policy that we came across that was interesting was the use of mental health providers. So part of the reason that so many children don't get treated for their illness is because there's a shortage of mental health providers for the area. So children are forced to wait on long waiting lists or travel long distances to get the treatment. But when they can't do this, they don't receive the treatment, and then there's just devastating consequences for the kids, like alcohol and drug use, school dropout, suicide, and many other consequences. So in response to this problem with the shortage of mental health providers, Representatives Patrick Kennedy and Ileana Rose Lighton introduced H.R. 1932, the Child Healthcare Crisis Relief Act. So this bill contained incentives to recruit child mental health professionals and to expand programs to train child mental health professionals. Some of the incentives that were included were educational loan repayment and scholarships for child mental health professionals, grants to graduate schools for field placements in the area, grants to training of paraprofessionals, and grants to grad schools to develop and expand child and adolescent mental health programs. So the main focus of the bill was to increase the number of qualified professionals in children's mental health so that the field could grow and expand to where it should be at. But unfortunately, the bill never became a law. It was referred to the committee, but then it was never reported. But the good thing is that bills that do not come up for debate are often reintroduced by a member in another session.
Children's mental health is an issue that exists all over the world. Every country has a different approach to dealing with it. Finland has a much different approach to dealing with it compared to the United States. Finland has always placed emphasis on children's mental health. More so now because in 2010 they formed a national healthcare project. This project stated that specific criteria was made for assessing children. They also put more money aside that now goes toward the children with mental health illness and resources that are needed for them. Funding that is set aside provides the children and their families with special medical care, family guidance, clinics that specialize in the prevention and treatment, and free health care, meaning they get compensated for their bills. The first step that Finland takes against child mental health is every child is evaluated for mental illness even if they aren't suspected of having an illness. The main goal is to prevent and treat children's mental health because they realize that it will only progress and get worse with age if it is left untreated. 10 to 15% of children in Finland suffer from some type of mental illness. The most common are depression and psychosis. Depression is a major concern, so they set a national program that is launched to help prevent and treat it. The main focus is to treat and prevent the reoccurrence of depression. Since psychosis is also a major issue, a lot is being done to prevent it as well. Physicians prescribe antipsychotics to the children suffering from psychosis. This is something that is not often done in the United States since antipsychotics are made for adults and can have some serious side effects. Psychosis left untreated can affect the child's everyday functioning. Along with meds, they make sure that the families are supportive of the child because their environment also affects their condition. They will often send the child and their families to counseling because illness can be hard on the families and cause unneeded strains. Another reason Finland is so concerned with treating mental illness is due to the high rate of suicide attempted and committed. 14 to 15% of children in Finland have suicidal thoughts or have attempted it, and most of them suffer from this illness. Finland's approach to mental health is a very successful strategy that can easily lead ways for other countries. All of the children in Finland that have a mental illness are being treated and have it under control, allowing them to live normal lives, preventing their families from unneeded stress. This allows the child to have a normal adult life because their illness has been treated and diagnosed from childhood. This strategy has been proven to work because the number of suicide attempts have decreased, as well as the number of individuals suffering from substance abuse. Both substance abuse and suicide go hand in hand with the mental illness because it is often known that they try to self-medicate. Finland is preventing these issues by making resources available to the children and their families. Finland has made sure to make the public aware of children's mental health by promoting the issues, which allows the parents to get their children checked out. In Finland, it's a public issue that is discussed and taken seriously to allow the children to receive the proper resources and treatment they deserve. Much of this is done by the fundings that are set aside for the children's mental health. The strategy has had a major impact on children's mental health in Finland, doing what they can and using the knowledge they have to help prevent and treat the illness. that allows the children to live a relatively normal life. There are many future trends in the future that can have a great effect on children's mental health. One of the trends would be to realize that most mental health issues begin in childhood, therefore children should be treated in childhood. Once the focus is put on this issue, this may be realized and this can cause it to be put under control and possibly prevented in adulthood. If people realized what an issue it was and took it more seriously, more policies would be passed. This would also lead to adequate fundings to help fund resources for the child and their families, as well as for research on children's mental health. By allowing people to see that it's a national issue, parents may begin to notice behaviors in their children and catch mental illnesses at a young age, preventing it from getting any worse. Another trend that could occur would be for an antipsychotic drug to be made specifically for children. This would be very beneficial for children because it would be safe for them to use with no serious side effects. No physician would be hesitant to prescribe it to them since it is made specifically for children, and once the product was presented to the public, people may begin to realize that children's mental health is truly a problem and needs to be taken seriously. The only way an antipsychotic for children can be made would be for lots of research and proper funding to be set aside. So were this to occur, this issue needs to be realized as a major problem. All of these trends would be beneficial to children's mental health. Many people would gain knowledge and action would be taken. Hopefully one day in the near future, change and action will be made and children's mental health will be funded, treated, and prevented.